Welcome to the Social Exchange Podcast. I'm here with my arch nemesis, Dr. Rick Barnett. I'm just kidding about that, by the way. If you've ever followed the podcast before, you'll know that Rick is now, on this day, my most featured guest, just in front of Johan Hari and Michael Shermer. So congratulations for being most featured on the Social Exchange. You win nothing.
Wow, that's impressive.
But we will have a robust conversation, hopefully. You and I were just talking about we might be winging this just a little bit.
Yes.
I'll set it up, and hopefully you can actually enlighten me a little bit about it, because I'm also going in blind. You're undertaking a journey to be trained on how to use psychedelic drugs in effective psychotherapies. And so there's so much to unpack about that, because obviously that's not something that happens in Vermont right now, but you're a practicing psychologist in Vermont. So tell me a little bit about how you're interested in that and what you hope to do.
Yeah, I'm super excited about this opportunity. There's an awesome training program in California through the California Institute on Integral Studies called the Certificate in Psychedelic-Assisted Psychotherapy and Research. And I learned about it after hearing a talk by Michael Pollan, who people know wrote a book, came out a couple of years ago, called How to Change Your Mind. I saw him at an American Psychological Association conference give a talk on his book and the topic in general. At that point, I'd already been intrigued by the growing awareness around psychedelics, psychedelic research, and I found this program, and I was like, I have to do this, because I have a personal history with psychedelics. I have a long professional career so far. Well, I think it's pretty long. It's going to be a hell of a lot longer, too. Career in mental health and addiction. And this seemed to sort of merge these two worlds quite well. And I just was so fascinated by the fact that there's so much research coming out now, and there's so many clinical applications potentially for using these medicines, these psychedelic drugs, psychedelic molecules to help people overcome various situations, and we can talk about that.
Personal history with psychedelics. Care to explain, or are you willing to do that?
Yes, I am willing to do that, yeah.
As I was asking the question, I was like, oh no. As it was coming out of my mouth, I thought maybe I should have checked on this first. Please.
No, I'm comfortable talking about it. I think it's part of why I'm fascinated by this. But as a young person, people know that I'm in long-term recovery from addiction. And what I would say when I went into rehab, one of the questions I ask is, what's your drug of choice? What's your drug of choice? And my drug of choice was always pot, alcohol, acid. I would always say pot, alcohol, acid, because I smoked a lot of weed when I was a kid, I drank a lot, and I used a lot of hallucinogens. And that seemed to be my go-to drugs of choice. When I got into recovery, it's a funny story. If you don't mind, I'll get into it. One thing that came across early on, I was in rehab, and a guy came up to me in rehab. He's like, Rick, you're a guy that's done a lot of psychedelics. Don't you think all this stuff we're learning about, like the 12 steps and recovery, like, don't you think we could just like meditate and or just like take a bunch of acid and we can figure it all out and we'll be transformed by that? And I was like, at the time I was like, no. I tried that. I did it for years trying to figure out, like, go on a spiritual quest or whatever. And very quickly it turned into just, recreational use, be like out of control, and the whole spiritual side of things, or the transformative or transcendent nature of it, was completely lost. So in early recovery, I was like, absolutely not. That is like the wrong direction to go in.
You use it sort of destructively, like into oblivion,
right,
rather than ever picking up on the subtle or maybe overt spiritual sort of mind-changing or altering aspect of it.
Right, but the most important part is that when I first took LSD as a very young person, I had a profound experience that I don't think ever left me. And I think this sounds funny, but I think it is responsible for why I got into recovery, and I've stayed in recovery this whole time, stemming all the way back to my psychedelic experiences before I even really developed a problem with alcohol or other substances. It basically like opened my mind to seeing the world in a very different way. So when I got into recovery and I was learning about recovery principles, AA principles, things like that, I was like, oh, this is so consistent with the stuff that I was experiencing when I was first using psychedelics. So that really attracted me to to wanting to stay in recovery and learn more about recovery-related principles. The harmony between the two is fascinating. And in fact, a lot of the research being done now is using substances like LSD, like psilocybin, to help people with alcoholism, with substance use disorders, to try to see if you can work with them to shift their mindset in such a way that there are other things that seem so much more compelling about life, that you don't need to use alcohol or drugs as much. Similar to the Life Process program, instead of focusing on the drug itself, you focus on the individual and their experience and what are their values and what are the cool ways in which you can live life and do different things. And I think there's something about hallucinogens that just, they say this, like opens up ways of thinking of yourself, the world, your beliefs, everything differently than you had historically. And that is, an incredible opportunity to change and grow.
I'm somewhat convinced that is the case. I'm more excited about learning, I guess, through you and through the new studies that are coming up, Johns Hopkins being one institution that's really, and there are, what is it called, MAPS, that has been so prolific now about research on psychedelic drugs. I'm really interested to learn what's not true, because we were talking about this just before we were airing. A lot of people have bought in wholeheartedly to the fact that psychedelics are mind-altering in some sort of ameliorative way. And I worry about that because I worry that people are going to give credit for psychedelics doing more than they can actually do. Mm-hmm. And that would actually hurt the case for someone like you who's trying to use them in a practical way, in a true, logical, well-tested way. Mm-hmm. Where do you stand on that? Is that gray in your mind, or do you feel like you have a sense of how they do work and how they don't work, or what is true about them, or what is being said about them that maybe isn't true?
I have a great concrete story about that just came up recently as Monday night. I would say that it's very clear, and I want to just say anybody listening, I'm learning about this stuff as we go. I have a history, personal and professional, in terms of my own experiences, as I've talked about, but also knowing a little bit about pharmacology, psychopharmacology, and psychotherapy and the applications in an appropriate way. I can say that there's a lot of, just like with I think anything coming out in the research, evidence-based research, there's a lot of hype, there's a lot of headlines, there's a lot of stuff that people, even the way I was probably talking about it a minute ago, sort of talking very glowingly about the positive potential for psychedelics. And I think it really does need to be tempered quite a bit. Now, the story that I was going to tell you was that in my growing experiences here, I've been in contact with people who actually do offer some sort of underground type psychedelic retreat experiences. And I had a fascinating conversation with somebody recently who's done this with over 400 to 500 people, offer psilocybin retreats. And he was very clear. It was just fascinating. He was very clear. He's like, Rick, people think this is some sort of panacea. Like they've been struggling with depression for years and they've tried everything and they think they're gonna come to this retreat, take the psilocybin, and somehow it's just going to magically change their overall orientation and outlook on life, and they're going to feel better. And he said, people just don't understand. There's a experience that you have on the psilocybin or on the hallucinogen, but it's really what you do with that information afterwards that makes all the difference. And one of the key components that I'm learning about, and people who know this have heard about, is that this is not intended to be some sort of haphazard, recreational, self-administered, self-medication kind of thing. Although people can do that if they want, and people have done that. I did that when I was younger. This is really about a preparation phase where people, believe it or not, either microdose before they actually go on. We can talk about microdosing. Microdose before they go on these retreats, so they're used to the experience. That's like some sort of preparation. But really, in a clinical way, you sit down with a therapist or a skilled professional and you do a thorough assessment. You develop trust and connection, unconditional trust and connection to the person or the group that's helping you with this experience. Then you have the psychedelic experience. And then there's integration period where afterwards you're following up with that same person or group of people, and you're talking about your experiences while you were under the influence of the psychedelics. And that could be days, weeks, months later, where you're just processing all the new awarenesses that you had. It's very different to do it that way than to just go away for the weekend and take a lot of hallucinogens and kind of go out of your mind for a little while and then just go back to work and
Sure.
sort through it on your own. So it's a very specific protocol, and I'm much more eager to learn about the standardized processes that go into delivering this kind of treatment in a really robust way.
I want to get into how you're going to be learning about that. I was imagining while you were talking that I know a few people who swear by their psychedelic experiences changing their lives for good. And I always wonder when they talk to me, were you just ready for that to happen? Did you, I think like your friend or your colleague was saying, did this person just try everything and was so fed up with all the things they'd tried and really racked their brain around the fact that they wanted to change, decided wholeheartedly, invested in the fact that they're going to change, then use psychedelics, and then had a confirmation bias? It's like, well, yeah, they're ready to kind of turn a leaf at that point. And similarly, I suppose that the studies that are being done around psychedelics and their potential use in therapy will have to parse that out as well. Like, would this robust therapy that's being done alongside psychedelics be just as effective without them? You're going to, I think you already mentioned it, California, to an institute to get a certification to be able to prescribe. We're not able in Vermont, or I don't know, in the US, right, to prescribe psychedelics or to use psychedelics in a therapeutic setting yet, or am I wrong about that?
You're absolutely correct. It's a Schedule I substance, just like cannabis, believe it or not, federally, and cocaine and other substances are all in the Schedule I category, which says that it's a high abuse potential and there's no really recognized medicinal use for it, which is total crap. And there's been thousands of studies on the medicinal benefits of LSD, believe it or not, and MDMA is actually probably going to be FDA approved as a treatment for PTSD starting in 2021, and that's part of the training that I'm going through to learn about ecstasy, MDMA. And so no, you can't. I mean, the only way they're able to help train people is that there's a heavy research component. There's all kinds of regulatory processes that people have to go through to get approval to run studies using psilocybin, using psychedelics, using MDMA. So I know that MAPS, which is called the Multidisciplinary Association for Psychedelic Studies, MAPS is a very well-known, growing organization. They're partnered with the California Institute on Integral Studies. They have many research arms across the United States. You mentioned Johns Hopkins, University of Wisconsin, many other places that are doing these studies, even private institutions that have some regulatory pieces in place so they are able to administer psychedelics to subjects who volunteer to be part of the studies. That's the only way that can be done. I'm not going to a clinic where they're just doing psychedelic-assisted psychotherapy and learning how to do it. It's part of a research project.
In just a minute, let's cut to a clip about the place that you're going to visit and attend. No, let's cut to it right now, and we'll talk about it when we get back.
In these studies, psilocybin and MDMA has been found to decrease existential anxiety and angst if they're at end of life. And for addictions, it has decreased rates of relapse in an unprecedented way.
A person that is suffering from post-traumatic stress disorder reaches a certain threshold where they continue to experience suffering. The therapies that are being researched, they have demonstrated conclusively that you can get almost a total remission of post-traumatic stress disorder symptoms through the use of MDMA combined with proper preparation and follow-up.
It's called the Certificate Program in Psychedelic-Assisted Therapies and Research, and it trains students to use psychedelic-assisted therapies primarily with psilocybin and MDMA, FDA-approved medicines for research in the United States. The second goal for us with our students is to be available for expanded access, compassionate care programs later on as psilocybin and MDMA's last iterations of clinical studies are going on all over this country, for them to be in a clinic giving psychedelic-assisted therapy to patients.
I work with communities of color and adults who are victims of crime. I think about how we can start to offer people who have severe trauma in their lives a possibility of a different kind of healing.
The faculty is world class. Charles Grob and Ralph Metzner and Michael and Annie Mithover. It's mind-boggling.
It feels like a torch is being passed, and this group is fantastic. The teachers are fantastic. Everything about it. I can't say enough good things about this program.
The center is a pioneering program, training what might be the vanguard of a psychedelic research movement that will be able to optimize delivery of treatment and hopefully have a big impact on the evolution of the health and mental health field and on our culture at large.
The future that we're most excited about in the center is to be in an FDA-approved study that would utilize our graduates, all these licensed professionals who would like to do this, here at CIIS. We're very excited to try and do that next. So that's our next future endeavor.
So that was so people don't think we're just a bunch of hippies talking about psychedelics.
Right.
I don't actually remember, we weren't able to actually watch or listen to the video while it was playing, so people at home just saw this. It might have said in the video, but just in case it didn't, you were mentioning that the FDA is fast-tracking or expediting the process of psychedelic mushrooms becoming legal to operate clinically, right?
Yes, yes. There's been enough evidence so far, I believe, that has convinced the FDA to fast-track psilocybin as a molecule. Now, keep in mind that the way these studies are best conducted, again, to standardize. And one of the standardization processes is not just the set and the setting in which these therapies take place.
Set meaning mindset, right?
Set meaning mindset, meaning the interpersonal dynamics that are going on between the patient and the therapist and the whatever the organization is that's doing it. So the mindset, the culture set, the climate set. And the setting is the environment that is taking place in. And the dosage has to be standardized because, with cannabis, for example, you can have various levels of CBD and THC and all that kind of stuff. Now, with psilocybin, you can actually isolate the psilocybin molecule. So I believe what they're using is a pharmaceutical version of psilocybin. It's not just clients or patients using, 8 grams of mushrooms or whatever. They're just eating the mushrooms and seeing what it does. It's a very standardized dose. They have, 2.3 milligrams, 6.8, all these specific dosages. So they're comparing low dose and high dose and placebos and all. So there's a standardized dose, and that's really important.
Let's talk about that purity aspect for a second. I was talking to Ben Westhoff, Ben Westhoff is the author of a book called Fentanyl Inc. So he went, I'll just backtrack because now I realize I brought up a name that maybe everyone doesn't know. He went just rogue.
It's a great podcast, by the way.
Thank you. Yeah. I was actually surprised. I met him at the Drug Policy Alliance conference in St. Louis. He lives in St. Louis. And I was talking to him about his book, and then I was reading it. I was like, wait a minute. He just went by himself to China, and he went undercover. It was like from a comedy movie where they would say, hey, you're not a journalist, are you? No. And you learn a ton about how they manufacture the ingredients to make drugs in China, then send them from China to places that don't mind putting those ingredients together to make the kinds of drugs that are potentially dangerous in the U.S. And then, of course, those get stomped on, so to speak, mixed with other things, again, once they're in the U.S. Right. So there's an aspect of, insofar as psychedelics are dangerous and have great risks, most of those risks, I'm sure, you'll educate me if I'm wrong at all about this, come from not knowing what's in them, as opposed to being pharmaceutically tested, legal, knowing that they're pure.
I think that, yes, I think purity is always going to be an issue, but with psilocybin mushrooms grown widely available in many areas, I think the safety profile from a physiological perspective is it's super safe. I mean, these drugs are super safe. This is not fentanyl. This is not cocaine. This is not stuff that's being cut. Now, with LSD, I remember back in the day when I was using LSD as a kid, you'd always hear about, ooh, this has a lot of strychnine in it, or it feels speedy or something like that. So I don't know what LSD can be adulterated with, but and I don't know what quality LSD is out there right now. I
was thinking more like LSD and MDMA more than psychedelic mushrooms.
Yeah, MDMA. I mean, dancesafe.org is a very well-known organization that used to have MDMA test kits at raves to sort of see if it was MDA or MDMA or some other version of it, or just a caffeine pill or something. So yes, I think, again, the pharmaceutical grade version of ecstasy or MDMA. Psilocybin, I really don't think you can adulterate psilocybin. I don't know, you can get a bad batch of mushrooms, I guess. Again, this is stuff I'm going to learn, but people who grow mushrooms on their own, and certainly the research that's being done with pharmaceutical capsules of psilocybin, that's all pure and standardized.
That's what I'm saying, is that there is a benefit to this process of it becoming legal to practice, in that there's just no question about purity and no question about dose, really, or very limited question, I guess.
Right. So yeah, I think with the psilocybin being fast-tracked, MDMA is supposed to be maybe FDA approved as early as 2021 for PTSD. That's a synthetic drug. That's a different molecule altogether than a plant medicine, but it's still loosely considered in the hallucinogen class, although it's really not pharmacologically. It's more a combination of some sort of serotonin, dopamine active drug, and psilocybin's very different. It's very serotonergic. All the hallucinogens, ayahuasca, LSD, psilocybin, DMT, they're all very serotonergic. They act on the serotonin system, but in a very different way than what we think of as SSRIs. And that's a very important point, and that's something that we learn about a lot as I'm reading and learning about this area. One experience with psilocybin, or maybe just a few experiences with psilocybin once every year, once every 6 months, something like that, is very different than the current mental health medication model, where people are prescribed Zoloft or fluoxetine or Celexa, where you take it every day, and there's side effects, and it's difficult to come off of if you choose to come off of it, and it's a totally different way of treating mental health. It's revolutionary, really, when it comes to oh, you mean I just go somewhere, meet with someone for a few sessions, I have this one experience with this chemical, and then I have weeks or months later where I talk about the experience and I integrate it into my life. I don't have to take something every day to treat my mood instability or to help me with my drinking or my drug use. With buprenorphine or methadone, you have to take the chemical every day because you're staving off withdrawal. It's very helpful to save lives so that people are less inclined to go out and maybe use fentanyl or use other opioids. With this, once if it were to be used for opioids, which is not necessarily recommended. I'm not saying someone should go out and use hallucinogens to get over their. It's
on the table already. You didn't have to bring it up.
Right. I don't mean to say that that's because pharmacologically they're totally different experiences. Yeah. But if someone were to use naltrexone, for example, so all the opioids are out of their system for a month or a couple of months.
Explain what naltrexone is.
Naltrexone is an opioid blocker. So Vivitrol or Revia, which is a naltrexone, it basically binds to the opioid receptor. So somebody who tries to use an opioid really can't get high. It doesn't produce the effect they're looking for. But if they're off opioids altogether and they're looking to sort of change their thoughts and their beliefs and their ideas about who they are in the world and their values, and they would go and try a psychedelic experience, that actually might tip the scales in favor of a very different trajectory for a recovery process because something has really shifted. And I believe, again, this is going back to my own experience, I believe that some people who attend 12-step meetings actually have that transformative process through meeting people and thinking about their life and their values in different ways. And I believe that's what happens with the Life Process program. People sort of look at their lives differently, look at the things that they value, how do they want to live their life, and a sober or recovery-oriented lifestyle becomes much more attractive than the addiction lifestyle, even though the addiction can always pull us back. And so hallucinogens, I think, fit right in with all of that stuff very well.
This is crucial, I think. You're making a distinction between what we're used to, at least in America, with respect to prescribed drugs for things like depression, mental illness, and addiction. Let's take methadone, say, where somebody is taking methadone every single day. I mean, I know a lot of people who have to take a bus from God knows how far away every morning to make sure that they get their dose of methadone in the morning, and that keeps them stable. So there's this difference between the drug giving someone stability while they can do the work versus with psychedelics. I think you're saying the idea, sorry for my cold, I think you're saying the idea is that someone can have an experience one time, map that experience onto living, and then return and talk about what life was like, perhaps have another sort of psychedelic experience or mind-altering way of thinking about things, and all while engaging in therapy. So it's sort of a more natural way of going about rethinking life and what's valuable to them.
Yeah, for sure. It's fascinating. It's just a really different model, and that's, again, part of the reason why I'm so excited about this is because it combines so many things that I've been interested in for years, personally and professionally. I love psychotherapy. I love treating and working with people with mental health issues. I love addiction. I love treating people with addiction in different ways, whether it's a harm reduction approach or a 12-step approach or abstinence-based approach or just a lifestyle improvement approach. And I live recovery myself, and I believe in recovery principles and change and the sort of the existential or spiritual side of things without getting too woo-woo about spirituality. Like it's a really important component of our lives for a lot of people. It's not for everybody. I know that for a fact. Again, going back to what we were talking about before, people have this expectation that they may try this psychedelic experience, this treatment model, and that's supposed to, cure their depression or cure their anxiety, and it doesn't always happen that way. Whether there's a confirmation bias going into it where people are so hyped up. It's like when someone says, oh, this is a really good movie, you got to go see this movie. Right. And you're like, oh my God, this could be such a great movie. And you're kind of like, that movie wasn't that great, actually, because you were all hyped up about it.
You'll learn if there's a confirmation bias or not. You'll be learning about things like that. But at the very least, if you learn or decided on your own, well, okay, maybe there is, or maybe you're unsure, the risk is much less.
Yeah.
Because you're not making somebody become wedded to, a daily maintained dose of something in order to survive, basically.
Yeah, exactly. Yep.
So let's get away. You said you don't want to get too woo-woo.
Yeah.
Let's bring it back from woo-woo to, not you didn't, you were fine, to something concrete. You obviously want to do something with your certification. Tell me about what you'd like to do and how you'd like to apply it and when you think you might be able to.
Yeah, I don't know when or if it's going to be possible in Vermont. I know that there's a bill, Representative Brian Chena and a couple other reps signed on to a bill that is not planning to be taken up for any discussion anytime soon, but H878, I think it is, that basically decriminalizes all plant medicines, including ayahuasca, psilocybin, mushrooms, a couple others listed in there. Again, that I think was just put out there to sort of get people thinking about it. There's a massive movement right now to decriminalize possession of buprenorphine or Suboxone. So my argument is like, why are we going to decriminalize Suboxone, which is, probably as dangerous or whatever stigma associated with it that as psilocybin is. So why don't we just decriminalize psilocybin as well? There's a movement now to decriminalize. Well, psilocybin has been decriminalized in a couple of states and in Denver. But my goal would be that at some point, if it were to be legal to administer these types of treatments in Vermont, I would totally be on board. I want to be one of the first people to be able to do that. I'd set up a system much like I hope what I'm going to be learning in California, right here in Vermont.
Where you would be teaching?
I would be teaching therapists how to do it and also offering the treatment.
And is this certification in California going to be sufficient to be able to offer treatment once it's available legal Or you'd have to know the legal
I'm not really sure. I think that my understanding is that this is a part of a broader training for MAPS. We talked about MAPS before, so MAPS is affiliated with this. I don't think this meets all the requirements, certainly for the MAPS MDMA ecstasy protocol, but it's going to be a large part of it. So whether it certifies me to be able to deliver this once it's legal to do so or not remains to be seen. So again, I'm at the very front end of this. It's super exciting. I can't believe I'm actually going to do this, and I think it's really transformative, not only for the mental health field, for addiction, but for society. Its potential is amazing.
Yeah, this is really cool. You said you're going to be the 5th cohort to ever go out there, right?
Yeah, the 5th cohort of this class. I know there's other training programs, I think at NYU and UCLA, the Hefter Institute, but this is one of the well-known ones that's tried and true, and I'm the fifth class to go through it. Yeah.
That's cool. When you started talking about the fact that you were going to do this, I got really excited about it, so I wanted to make sure I talked to you. This will probably go on. I think I host like 4,000 podcasts now, so this will probably stream on all of them somewhere.
That's awesome. I'm so excited. Hopefully, it's helped to raise awareness. You know, it's a growing movement, and people are getting really excited about it. Again, we need to temper our enthusiasm a little bit. I'm cautiously optimistic about it, but it can go sideways very quickly, as it did in the 1960s, as we know, and we really don't want that to happen again. This is a serious endeavor to get it right this time and really help a lot of people.
I want to end there. We have like less than a minute left or something like that. But what do you think, what would be the downsides of being unduly optimistic about psychedelics as opposed to getting down and just being practical and being as skeptical as possible?
Well, I think the downsides really is that when you start to ingest these molecules and start to have these experiences, people can get very exuberant and get very, for lack of a better word, trippy about their experiences, and that can be vastly promoted in all kinds of sort of wild and maybe difficult to understand ways. And if there's too much of that out there, then it's just going to go down the same road that it did in the 60s. And Terence Mckenna is...
Which is what? Let's just talk a little bit about that.
Well, Timothy Leary, for example, in the 1960s, he really took it to another level. I'm not saying there's anything bad about that necessarily, but it did change the whole cultural mindset around the clinical utility of these chemicals. And then Terence Mckenna, also another person in the 1980s and 90s who is just an amazing mind, and if you listen to any of Terence McKenna's stuff, it's so fascinating. But again, it has the risk of sounding a little bit, out there.
New agey.
Yeah, and people, you need to bring it down to earth in a way, but also still allow it to be as mystical and hard to grasp as it actually is. It's balancing those two is a little challenging.
All right, well, you're going to do the work to help parse that for everybody else around here, and good luck with everything.
Thank you.
But wait, Rick, isn't it expensive to go do all this crap?
It is expensive.
There's going to be a lot of costs incurred, I suppose.
Yes. I did put out a GoFundMe campaign to help, not only help with the cost of the training for me, but really the spirit of that is to bring this back to Vermont so I can educate people in Vermont, offer free trainings and seminars and workshops and public education opportunities so that people can raise their awareness. And so that's what the GoFundMe campaign is really about. Not less about the tuition for the program, more about what I do with it once I have it and can bring it back to Vermont.
So I'm making an assumption that this is even something that is going to motivate people, but we'll just go to screen right now to show a graphic of your GoFundMe. If people want to donate, great, you should. Check out the link, it'll be in the show notes. And if people donate $100 or more between now and March 15th, then you'll get a free signed copy of my book with Stanton Peele called Outgrowing Addiction. Rick, thanks so much for doing this, and we'll talk again when this is all through.
Yeah, thank you, Zach. That was awesome.
Take care.